Hello everyone, welcome to my YouTube channel. Let's start crafting. Let's talk about cough, a very common symptom of presentation in our aesthetics and ED. Cough is divided into acute and chronic, especially if it's running for more than 3 weeks. If we talk about acute cough, it can occur because of either an inhaled foreign body or respiratory tract infections. Remember to look for monophonic wheeze, which can be heard on auscultation in cases of foreign body ingestion. If we talk about chronic cough, it is divided into productive and non-productive cough. Productive cough can occur because of underlying COPD, bronchiectasis, tuberculosis, pulmonary edema, pulmonary embolism, or underlying lung cancer. Always ask about smoking history, which can help with the diagnosis of COPD or lung cancer. If patients coming from an endemic area where TB is endemic, always ask about tuberculosis. If patient has underlying heart condition, keep in mind that pulmonary edema could be the cause for the cough. Remember, pulmonary embolism and lung cancers usually present with blood-stained sputum. Non-productive cough. It can occur because of asthma, sarcoidosis, pulmonary fibrosis, underlying GERD as a part of postnasal drip, or with medications like ACE inhibitors. Remember to ask seasonal history if you're looking for asthma. Occupational history can help with the diagnosis of pulmonary fibrosis, and some general history about GERD, heartburn could help with the diagnosis. Okay, folks, let's just talk about some general investigations that can be done as a part of workup. Get a chest x-ray done first. It can help rule out opacifications, underlying mass, or curly V lines. Set a full blood count to look for WBC count, which can help rule out infections. Look for eosinophil count for asthma. Send some viral throat swabs, sputum cultures, both bacterial and TB if warranted. You can do a bedside test called peak flow, which is low in asthmatics, or if there is a query between COPD or restrictive lung disease, you can get respiratory function tests. If we talk about specific investigations, you can do a CT thorax, which can help with the differentials like sarcoidosis, lung cancers, or fibrosis. You can do a CTPA if pulmonary embolism is what you're looking for. pH studies can be done if the underlying differential is good. That's it for today. Thank you for listening.